companies. Well, for more on this growing issue, Dr. Chukwujama Ejiofor, the second Vice President of the Nigerian Association of Resident Doctors, join us for more on this. Very warm welcome, Ejiofor, to Newsnight. How would you react to the myriads of, issues raised by the minister? Some of you or your colleagues are illegally recruited to the, payroll is bloated with fictitious and like ghost workers. Yeah, that's quite telling.
Well, thanks once more for having me. Some things are actually laughable when you hear them coming from someone we look upon, as being a very senior colleague. There's something with a lie. You see, when one keeps on telling himself a lie and keeps on telling others the same lie, it becomes pathological. Okay, and you're talking about illegal doctors. Who employs those doctors? Does NARD employ doctors? No. The Hospital Management Board, which is a representative of the federal government, Ministry of Health, recruits doctors. So what is why the thing on illegally recruited doctors? Did we recruit doctors? Did the NARD president recruit doctors? No. It's you create a problem and you come to heap it on us. Come on, give me a break. We shouldn't be hearing such things. It means there's a failure in government. Incompetence everywhere. A big failure in government. Which one is illegal doctors? Recruited by who?
I do know that NARD, you'd actually had accused Dr. Chris Ngige earlier, because I know that we had some of your members here, and even members of the NMA, they had said that the negotiation process is actually stalling due to how he's handling the entire process. But beyond this particular individual right now, I do know that there's a memorandum of action that was signed earlier in the year, which of course you said it wasn't implemented. That's why you are on the strike. So where are things standing at the moment in terms of negotiations and finding a lasting solution to this issue?
Okay, thank you. First of all the timelines in that MOA has elapsed, and he says he has done 8 of the things. That is another lie. That is another. Nigerians should actually ask for what the truth is. That's
why you're here to clarify for
us. Good. I'm here to clarify that.
First of all, claiming he hasn't.
No, he hasn't.
So what has been done and what is outstanding?
Absolutely.
Now, the only thing that has been done, really, but we're still waiting for the actual document, is the issue of the bench fee, which was said to have been abolished. We're still waiting for the actual papers on that, okay? But the medical registration funds, it is yet to be paid. Debt in service insurance, yet to be handled. All arrears to resident doctors, yet to be handled. House officers, 114, yet to be paid. And I'm hearing about salaries and allowance being different, when people don't know that allowances are percentages of salaries. People should stop mixing or joining issues. We have a fundamental problem in the health sector. People are dying. We shouldn't be hearing,
and that's why Nigerians. That's why, Dr. Ejiofor. That's why Nigerians are worried that you could still sustain the strike this long. Almost 22 days now.
More than that. It's about 6 weeks.
It's 42 days.
42 days. Yeah. You don't see this kind of situation in other climes where they'll give warning strikes, 2 days, 1 day, and the rest. And they don't collapse the entire health system. The entire health system is almost collapsed because of your actions. Are you happy?
Nobody in Nigeria is happy. Part of the major problem is that we do not trust this government. Series of strikes on the same issues over the years. I was here in April, wasn't I?
Yeah.
I was very clear that it was preventable. It was clearly preventable. And nothing was done until we had gone on strike. And it keeps on going like that. All the timelines stipulated in every MOU has elapsed.
Okay.
Even the last one, they said they will pay us MRTF within 1 week. at the end of 1 week.
And it still hasn't
has
been paid.
elapsed.
All right, so I do know that, you know, this is a case that is in court, so we can't go into all of the details, so, you know, to avoid a case of sub judice. But at the end of the day, we have to look at the ordinary Nigerian who cannot afford to go to a private clinic at the moment right now. NARD, as an association, what do we need to do to get out of this impasse? And also, the no work, no pay that the government has threatened to implement, they said they had implemented it, but is it what is obtainable right now? Can you confirm that?
No
to
doctor
us?
has been paid August salary. No resident doctor has been paid August salary. No work, no pay has been implemented. And let's also remember too that it was during deliberations, in the thick of deliberations, that this no work, no pay was suddenly brought to fore. And you're talking with people and you're trying to be a reconciliator, a conciliator, and you're bringing about no work, no pay.
You have even made it known that it's the president of the Federal Republic of Nigeria that you want to see and take your
We don't trust the Honorable Minister.
So now you don't trust the
He's a
Honorable
doctor,
Minister.
he's a colleague. The Minister of Health is a senior colleague. Why don't you trust them?
Well, you see, when you do the same thing the same way and expect a different result, you just don't, you're not ready to move forward.
You don't trust them. So who can you trust now that can get us out of this quagmire? Because the Nigerian is the one who's suffering, while the two elephants, which is you and those in authorities, are fighting. How do we get out in less than a few seconds, if you can? How do you prefer a solution to this problem?
Okay, first of all, Nigerians have to know that the wrong information has been on air from the government representatives for quite a while now, saying that things have been sorted out. They have not. Had they been sorted out, why wouldn't we go back to work? It's clear, very clear.
All right,
so the president of this country should be aware that whatever is being briefed to him is wrong.
Well, you're not, it doesn't look as if the resident doctors are listening to Mr. President, because we know that he's made appeals to you that, look, sometimes these issues, they take longer time to,
let's find a middle ground at the end of the day. But we'd have to say thank you so much, Dr. Chukwujama Ejiofor, the second vice president of the National Association of Resident Doctors.